Hi, I'm Andy Aldred. I'm the pharmacy director at Cameron Hospital in Angola, Indiana. I've been here for about 7 years now. Um, I am the pharmacist, the main pharmacy director here, as well as the director of materials management here at the facility. So I run both of those departments. Some of the things that I do here at Cameron and like about working here at Cameron are the opportunities to do many different things. So when you work in a smaller facility like Cameron, they oftentimes come to managers to do other things that you wouldn't get to do if you were in a larger facility. An example of that would be project work for implementation of new technologies like new EHRs or ERP projects, as well as new things like smart pumps and smart IV pumps. Um, I also like working in a hospital setting because there's a lot of professional interaction that you don't get if you work in the retail setting. So every single day I'm working with physicians and nurses, respiratory therapists, radiology techs on many different things, whether it's about medications or about other things that we do here at the facility. So it's interesting to see the different dynamics between the different disciplines that are out there. Working in a smaller hospital does have some downsides or some differences to working in a larger facility. When you're in a larger facility, typically you do the job that you do and you don't get to branch out a whole lot to do other things. So if you're managing the pharmacy or you're working as a pharmacist, you're typically doing a lot of order entry. You're doing work in the IV room and managing that. You don't get the opportunity to branch out quite as much as what you would in a smaller facility. That being said, working in a larger facility, in a larger hospital, has its advantages. I've done that in the past. There's a lot more resources that are available, whether it's more people to help you with projects or help make things happen. So that's a positive thing. There's typically more money for capital and technology advances so you can get those things accomplished. So those are good things. Being in a smaller facility, though, offers you an opportunity to typically implement things a little bit quicker, though, when you can get those done. So being able to quickly change a policy or a procedure, there's a lot less layers of management that you have to go through and sign-offs to go through when you're working in a smaller facility. And you're typically in a smaller facility working with the same group of people over and over again on projects. I've also worked retail in the past, so some insight on the differences between retail and hospital setting. A lot of you probably already know this, but some of the things that retail offer you are more direct customer interactions than what I get here in my role at Cameron. And that can be a positive and negative thing. You get to meet people and learn a lot about their families and their history and what medications they're on. In the hospital setting, it takes a little bit more work to get to that point, and depending on what role you play, you may not have that particular patient interaction that you would in the retail setting. That being said, in the hospital setting, you don't have to deal with the medication insurance or the pharmacy insurance, and that's a positive thing. That can be difficult in the retail setting. In the retail setting, there's also a lot less interaction with professionals, so you don't get the opportunity to speak directly with nurses or physicians about patient care. Lots of times you're having those conversations with the patients themselves or the patient's family members, and there's a different level of communication that happens at that point. So those are some things that aren't as nice about the retail world in my estimation.